What is happening, everybody? Thanks for popping in here, joining me for a quick live here on Facebook, all the YouTubes. And what I wanted to do today, something a little different, because I pulled some audio that I want to share with you. And I wanted to kind of talk a little bit about Stridor today. That audio I'm going to pull is coming from turbulent.com. Usually just for members, but I think it would be helpful if I could share that audio with you in a few moments here. But I wanted to talk about Stridor, and I put it in the notes here as well, just kind of describing what it is, right? It's that external, audible, high-pitched sound. It's from that turbulent airflow that you'll get from an obstruction of the upper airway, the pharynx, the larynx, the trachea. And, this can be life-threatening, guys, because there is a big potential for the airway compromise and then, of course, leading into respiratory arrest and even more severe respiratory distress. So it's important for us to sort of identify this when we get these patients, right? So I want to just go. I'm going to go through the whole presentation on Stridor, but I wanted to kind of just give you kind of a big overview of it. So just to kind of, it's good to keep it fresh in your mind because we don't always hear this that often, and we don't want to just blow it off as being something that's non-emergent, right? Because these are the type of things that can become life-threatening rather quickly. So your typical signs and symptoms that you might have a patient complaining of, or a lot of times we hear Stridor in children, the parents telling you things like a sore throat, drooling, they can't really swallow, the voice might change, right? They get that kind of a hoarse voice, a fever, noisy breathing as well. And of course, difficulty breathing, which most of the time for us, that's when we're going to be getting called to the scene for these types of patients, right? So I want to let you listen to audio because something that I've found people struggle with is telling the difference between Stridor or wheezing. Before I do, just want to really quickly talk a little bit about some of the common causes. I just gave you some of the common signs and symptoms, some of the causes. So we talk about children. Most of the time for us, it's going to be that croup, epiglottitis. These are the viral sort of infectious causes, all right? But you can also get it from things like having a foreign body being inhaled for the patient, burns, anaphylaxis, and this is when you're going to, of course, with your history taking, your assessment, talking to the parents, things like that's going to come into play to help you to figure out, is it something viral like croup, or is it maybe something else like a potential foreign body inhalation? Maybe they were kind of choking on something. They might have inhaled a piece of food. Okay, it could have been that they swallowed a small toy, something like that. Adult can be also a cause for Stridor. Adults can have a Stridor as well, and they can get that epiglottitis or that supraglottitis going on. They can get trauma to it. A lot of times, if they're post-extubation, let's say they were intubated and they're recently extubated, you can have it from that as well. Again, burns, maybe even allergic reactions. GERD could also be something that might cause Stridor as well. So just some things and causes to think about when you're assessing your patients, to ask the right questions to find out what might be going on with that patient. So again, don't want to go over it and give you kind of too much information, make this whole big presentation. I want to just kind of give you this kind of a higher view of it. So when you get a patient and you're considering that this is the lung sound you're hearing, or that they might have croup and this is the lung sound you're hearing, or they might have maybe inhaled something and this is the lung sound you're hearing, that it kind of goes hand in hand, right? It's not just one thing that we're looking for when we're assessing the patient. We're looking at several different components to help us gather all the data and let us understand and be able to treat what we have to treat, transport appropriately to the right facility, and understand what's happening with the patient. Now, I'm going to go ahead and share these audios. I want to just double check, because what I want to do is share the audio in my system here, because I want to be able to go ahead and let you listen to that as well. So let me go ahead and do that. Hopefully you'll be able to hear this, guys. I have not done this quite yet. Let's see. Hopefully you'll be able to hear it. I want to go ahead and play the Stridor for you. I have two different videos. Two different audios I want to play for you. So this is one here. I'm going to turn my volume up in case it doesn't play in the system. You'll be able to pick it up through the mic. Okay. And again, these audios are inside TurboMedic. So if you are a member at turbomedic.com, you can access these and a lot of other audios as well. But I want to play two Stridor audios for you and then one Wheezing, so you can kind of see the difference a little, hear the difference a little bit. Okay. All right, that's one, and this is another Stridor. You can hear it's a little more high-pitched, right? And it sounds very similar to Wheezing. Let me play the Wheezing audio for you, and this is an inspiratory and expiratory wheeze. I chose the both inspiratory and expiratory so you can kind of really get a lot of the wheezing sounds here. I'm going to play that one more time for you. All right. I'm hoping you guys are hearing the differences there. If you are, do me a favor, just hit the like button so I know that you are kind of hearing the audios and hearing a little bit of a differences there. Like I said, I'm not sure if you're getting it through my system audio, which would be much clearer than it trying to pick it up on the mic. If not, I apologize. Again, those audios, along with a lot of other audios, are inside turbomedic.com. So if you're a member there, you can go ahead and log in and listen to those audios. If not, consider joining me. It's a great resource to help you be better at EMS. So I'm going to end it there, guys. I hope you got some value out of this. Please be sure to like the video, leave me a quick comment, let me know that you are engaged and that you're getting some value out of this. Again, I don't want to give you a big lecture, guys. I want to give you the high points. You can take this little chunk, and the next time you get a patient that you might think is having Stridor, or a patient who has croup or epiglottitis, and you listen to their lung sound, you can kind of pick up those differences between Wheezing and Stridor. Okay, so all about putting it all together, guys. Not one piece, a lot of pieces that all come together. All right, guys, I'm going to end it there. Thanks for joining me. I really appreciate it. As always, I'm Jim Hoffman from turbomedic.com. Stay safe.